Hi, my name is Shelby,
And I'm Sabrina.
and we did our topic on multiple sclerosis.
Okay, so the overview of what we will be talking about today in our PowerPoint, we are going to talk about what MS is, the signs and symptoms related to motor speech, the etiologies, the types of different MS, the treatment approaches, and then we will do an overview of the conclusion.
So, what is MS? I know we briefly talked about it in class, but MS involves random attacks on a fatty material called myelin that insulates nerves within the brain and spinal cord. So, as you can see here, it is an autoimmune disease and it does mostly and entirely affect the central nervous system. So, when myelin is attacked, the body is able to make up some repairs, but eventually patchy areas of scarring develop on nerve fibers where healthy myelin once was. And these nerve fibers, which we learned about in class, or axons, may also be damaged. And this is where MS can result in the loss of brain tissue. So, someone with MS may also develop muscle weakness, weak reflexes, muscle spasms, and difficulties in movement. But most importantly for this class, Sabrina and I have learned how it can really affect a person's speech and language difficulties, and how no patient is the same that has MS. And there's a severity of speech issues and language difficulties that can be seen based on the patient.
Okay, so the signs and symptoms related to motor speech are daily communication inconveniences, articulation deficits, word finding difficulties, impaired speech and language processes, oral muscle weaknesses, and difficulty with spontaneous speech tasks.
So cognitive processes in MS that can impact speech. So here are a list that I came up with. And as we learned, cognition refers to all the high level functions carried out by the human brain. So this includes memory, planning, problem solving, and processing information. And MS has the potential to affect cognition and the attributes that make us unique, either directly or indirectly. And this idea is upsetting, but the facts emerging from research are encouraging. While mild to moderate problems are relatively common, severe damage to these aspects of the self are not.
Okay, so etiologies. So there actually is not a certain cause. Research is still unsure what causes MS, but they think it may be genetic related, smoking, or environmental factors may cause it, but research is still very unclear.
So while Sabrina and I were doing our research, we were able to find 4 different types of MS. The first one is relapsing remitting. The second one is primary progressive. The third one is secondary progressive. And the fourth one is progressive relapsing.
There are 4 different treatment approaches for MS. The first one that I'm going to talk about is Botox injections. So that is when a small amount of injections are put into the affected muscles, and that can relieve spasms and allow for a smoother voice for the patient. The second is speech therapy, which is when the therapist may offer strategies and exercises for specific problems. And some exercises may strengthen and improve function of the muscle involved in breath support or speech production. There are also different techniques for slowing down and over articulating and pausing to help the speech more clear and more understandable. Third is voice amplification devices. This is for people with much more severe speech problems, and they can definitely benefit from amplification devices, electronic aids, or computer assisted alternative communication systems. So SLPs will have to determine what technology is obviously most appropriate for that person, and we'll teach them how to use it. And family and friends will definitely be trained and should definitely be involved in how to learn how to use these different communication techniques. Lastly is LSVT loud treatment. So this is delivered by SLPs who have been specifically trained and certified for this program. And this is an intense treatment program. I think it's about an hour a day and focuses on training healthy vocal loudness and helping people relearn the sensory perception of normal vocal loudness. So these are 4 different treatment approaches that can be used for MS.
So Sabrina did a great job explaining each of these treatment approaches in depth, but now we have to think of comparing the treatment approaches. As we have said prior, no patient is the same when a person with MS is like experiencing difficulty with speech. So maybe the person needs Botox injections where the injections are injected to affected muscles to relieve spasms and allow for a smoother voice. Or another way, as we all love, is speech therapy. And that the SLP can work on strategies and exercises to strengthen speech. This can be done by doing oral exercises to help with any oral facial issues, such as like the tongue, the teeth, the lips. Also, voice amplification devices, as we have learned, they're for more severe speech problems. And the LSVT loud treatment, those are to treat voice disorders in MS. So I really like how many treatment approaches there are because it just shows you how there isn't just one way to go about a treatment approach for someone with MS that is facing difficulty with speech and or language. So I like how we were able to compare a variety of treatment approaches.
Okay, so just to go over what we talked about, MS is an autoimmune disorder that occurs in the CNS and nerve sheath myelination takes place. And MS in regards to an individual's speech may be shown by a slow rate of speech, oral muscle weakness, and daily communication difficulties. Various treatment approaches for individuals with MS depend on the severity of the diagnosis, and not one patient is the same as they show all different signs and symptoms.
So to wrap up, we found all our research by using all of these scholarly sources, and we thank you for watching with us. So thank you.
Yes, thank you.